what can be improved with the catheter for you? Can you tell us?
For me now, or
now, for example, if you were, for example, in a team and they ask you, okay, can you help us to improve? What would you say?
Choosing the catheter, there's not that many obvious changes. We already have improved a few things. For example, safety. I mean, we use safety catheters to try to avoid getting injured. But you have to choose a catheter fit for the purpose and for the clinic that you work. And I think at the moment the catheters that we have as our first choice ticks all the boxes for us right now. But that can obviously change. The only thing that we haven't really brought up now, when I've used a few different types of catheters in the past, because we've had to order in different brands, is the flashback of blood in the hub is very different. You know, some you don't get anything at all, and some is not very clear. And that in the last few months, where we had to use different catheters, have caused a lot of problems for us, because you get very used to knowing when you're in the vein by seeing that. So if we can go back to our old catheters, where we have that visual help, that's something we're going to do. But that's that's not really improving on the past.
And you confirm to us that in the Nordic countries, safety is the first point. It's very
safety. It's very safety and hygiene focused here compared to UK and Australia. I find extremely so. And sometimes that makes it more difficult to use the catheters. I mean, the safety catheters are like bigger and more clumsy, so they're not easier to put in. But that's the trade-off, really.
And what about you, Maxime? Can you tell us, if you've been asked to join a team and to improve, what would you say?
Oh, it's a very difficult question, because it depends on what people are aiming or dreaming of, or what the perfect catheter should be. Sometimes it could be the materials that are used, because I am in trouble with phlebitis and thrombosis. So sometimes getting a better material or different options on the same catheter size could be interesting, for example. And even if there is a big choice in brands and size, there is not that much in type, materials and structures. And so that could be my goal to change catheter, because safety is already here, I think, for most of them. So I think that there's not that much that we can do. But as Lee said, sometimes the flashback of blood in the hub could be interesting if we have better view or not, different system, easy connecting system or stuff like that.
Okay. And you, Petra, in England, can you tell us what is, if you join a team, what would you recommend?
So we're a bit behind on the whole safety aspect of things. We do not use safety catheters. In fact, when we saw them, we all looked a bit frightened. So I think the UK in general could step that side of things up, the safety aspect. I would also want a really nice, smooth placement, smooth coming off the stiletto. I really like, and I think that would help with the confidence for new nurses and vets as well, knowing they're not going to get stuck halfway. I also like a flashback, and especially if you have a trickier patient, a wriggly patient, you find yourself, you're in, and then they move. Sometimes it's nice to just be able to have a drop of blood come out, just to know you're still there, which I do quite like. But that does also, I suppose, have sort of implications for infection control and hygiene and things like that. You want to get that seal on there as fast as possible. But I do quite like a decent flashback.
Would you say that having the flash blood is like a green light when you're driving?
Yes. Yeah, you're okay. You can keep going. Yeah.
I would like to say thank you to three of you to have joined us and share the ideas. Thank you very much.
Thank you.
No, thank you. That was very interesting.
Would you like to say something just to end the conversation? Feel free to say something.
Yeah, Petra, if you want better catheter, you can buy the one with wings.
I'm going to try. I'm going to buy some, and I'm just going to sneak them into the catheter drawer.
They're gonna stay in the bottom of the drawer, I think.
I'm going to put one in, and then and just wait till it's in there and nice and secure, and then show it to everybody.
Cool.
And if I were you, Petra, I will ask Maxime to come to Paris and to train with the pigs inside.
I think they need to go to Paris. I think it's the only way, and I think work are just going to have to pay for it. I'll even bring my cat.
Thank you very much to you.
Thank you very much.
Thank you.
See you.